Well, there are only a few methods of testing for COVID-19. Here they are. The first one is the most common. And remember, during the first 2 months, that's all there was. People were being diagnosed by symptoms only. The precise presentation of the seasonal flu, those are the symptoms that created this phenomenon that has brought the world to a halt. The second way of testing for COVID-19, antibody test, blood tests looking for antibodies. Now the problem with this is that the philosophy of observing antibodies in the blood has changed 180 degrees. 15 years ago, the presence of antibodies in the blood could mean that the person had just recovered from some health challenge and that their immune system had created antibodies, which was evidence of their recovery. Now, the presence of antibodies in the blood means that this patient is afflicted with a pathogen that is potentially fatal and is in need of some heroic treatment. So, this is the way the antibody testing for COVID-19 was conducted. They would take the blood sample. If they observed any kind of antibodies, whether they were viral or bacterial or whatever, they did not differentiate. That was a positive test for COVID-19. Any kind of unidentifiable viral or otherwise debris in the blood was also counted as a positive test. Okay, let's look at the third type of testing, the PCR, the polymerase chain reaction test. This is the test where you had to send a sputum sample into CDC, and then they would test it with the PCR test, and they would send you back the result, positive or negative. It's a completely unverifiable test, as we're going to see, and we're going to go into the specifics of why that is. Next came the test kits. Now, the test kits were only sent out about a month ago. They were sent out actually around the middle of March. The CDC sent the new test kits to hundreds of hospitals and clinics across the country, and these test kits were supposedly to screen out people for COVID-19. The problem is, when you look on the CDC website, it says right on the description, for experimental use only, not for diagnostic purposes. For experimental use only, not for diagnostic purposes. And then it says the CDC is making no claims for their validity. So after those test kits went out to all the hospitals about 3 weeks ago, that's when we saw this enormous spike. Because of course, right away, when the hospitals finally got a testing procedure that they didn't have to send in to Atlanta, they could report a lot more positive tests. The next thing that happened was, after those first test kits went out to the hospitals, the most recent thing that only happened a week or so ago now is the on-site test kits. And these supposedly are claiming to be able to take a sample from a patient and to screen them for COVID-19 in 5 or 10 minutes. This is completely ludicrous. It is impossible. It is scientifically untenable. These will not work at all. No one even claims that these on-site tests can validly differentiate anything, let alone COVID-19. They're completely unapproved and untested. And yet, the positive results from these unreliable tests are being included in the running total of COVID-19 cases being reported every day on the news. These are the main tests being used in this country today to count the numbers of positive cases we see enumerated on the daily scoreboard, not for diagnostic purposes. These are the only tests that are driving the daily numbers. The fact remains, none of these tests is scientifically verifiable and reproducible, as a valid differentiation for COVID-19 specifically. They are all flawed and they're just estimates. Okay, so let's talk about the PCR a little bit more specifically here, okay? The polymerase chain reaction test was invented by Dr. Kary Mullis from Berkeley in the early 80s. He won the Nobel Prize for inventing this test. This test is touted by the medical profession then and now as the gold standard for diagnosing microbial disease in patients. They claim that it can specifically differentiate any viral disease from any other viral disease by sequencing the RNA and DNA. This claim is constantly made even today, and it is completely insupportable and untrue. No one was more critical of the PCR test than its inventor, Dr. Mullis. It was disavowed from the very first. Here's what he said, quote, "Quantitative PCR is an oxymoron. PCR by its very nature is unsuited for estimating numbers. A common misimpression that the viral load tests actually count the number of viruses in the blood. These tests cannot detect free infectious viruses at all. They can only detect proteins that are believed, in some cases wrongly, to be unique to HIV. The tests can detect particles of viruses, but not viruses themselves," unquote. So you can read more about that quote in the February newsletter. He was embarrassed, exasperated for decades about the claims that organized medicine was making for his test. It simply does not do what they claim. The amazing thing is, such extravagant claims have been made over the past 40 years for the PCR test by organized medicine that there has been no other technology developed in that entire 40 years which claims to make any improvement on the ability of the PCR tests to identify and sequence viruses and bacteria. Recently, I found this out that Dr. Mullis died a couple years ago because I would really want to interview him at this time. An interview with Kary Mullis at this time would be extremely valuable. Let's ask this question. Where's the science? Is the polymerase chain reaction test, is it closer to science or closer to science fiction? The claims are what? That the PCR can identify the exact RNA sequence of any virus, of a disease virus, right? They can then compare that sequence that they read on an electron microscope, make a micrograph. They can then print that sequence out and then compare sequenced viral samples from patients, right, with that master sequence, looking for an exact matchup. And an exact matchup would determine whether it was a positive test. Did this patient sample have the exact same disease as the master sample? That's what they have been claiming all these years. A little research and we find out that it does nothing of the sort. The PCR test does nothing of the sort. And yet, this is the pitch used today by whom? Everybody. Doctors, hospitals, medical journals, everyday media, TV news, the bureaucrats. Everybody is making these same false claims about this magic golden box, the polymerase chain reaction test. This is the epitome of junk science. Here's how the PCR test works. A DNA helix is cleaved, so it's separated, right? You take a section of one of those strands, and then you begin to double it, because it's very, very small. The PCR test can double it. That's what it does. And then you double the double, and on exponentially like that. And finally, something very, very tiny becomes visible, supposedly measurable. Now, of course, the coronavirus is RNA, So that has to be, like all viruses, right? So that has to be converted to DNA by reverse transcriptase, and that's what RT-PCR stands for. Every time they double a section of RNA, that doubling is called a cycle, okay? So they keep doing it and doing it, doubling and doubling it, cycling and cycling. The test counts how many cycles until RNA is detected. And then they keep on doubling it until the RNA disappears. And this range of numbers, that's all that the PCR test really does. It gives you a range of numbers. That's all the PCR test does. Now, you could spend a lot of time researching the science of the PCR, but I found a review of the literature that's going to save you a lot of time. This is by David Crow called "Does Coronavirus Exist?" You can see the URL here. You can also find it on the show notes. Here's a quote from that study. The coronavirus test is based on PCR, a manufacturing technique. When used as a test, it does not produce a positive or negative result, but simply the number of cycles required to detect genetic material. No new virus was ever purified. Now, purified is a specific word. It means that the virus is separated from everything else so that it can be sequenced. So no new virus was ever purified by the Wuhan scientist. That's his notes number 2 and 3. And the same is true in America. No novel virus for COVID-19 has ever been purified by any scientist in the United States either. So are you beginning to understand a little bit Dr. Mullis's exasperation all those years? The PCR test does not isolate and identify viruses. It does not provide RNA sequences of pathogens. It offers no baseline for comparison with patient samples. It cannot determine an infected from a non-infected sample. We are looking at a device for marketing and promotion of testing. Here are the conclusions. Quote, "The coronavirus panic is just that, an irrational panic based on an unproven RNA test that has never been connected to a virus, and which won't be connected to a virus unless the virus is purified. There is very little science here." So this is the best kept secret. You will never hear any of this in media. This is just an introduction to the problems with the PCR test. It's much worse than I'm describing here. So the other tests that we listed here are even less reliable than the PCR test. By symptoms only, the symptoms of COVID-19 are identical to the symptoms of the flu. We talked about the blood tests, how unreliable they were. The hospital test kits, these are for experimental use only, not for diagnostic purposes. And the on-site 5-minute tests are even less scientific. So with respect to the test kits that were sent out to the hospitals a month ago, this is the best kept secret. You can find no research, you can find no evidence, no description of how these test kits are supposed to work. It's a forbidden topic of discussion in corporate media, right? They were released by something called the EUA, an emergency use authorization from the FDA. These were brand new tests. They were unlicensed. They were untested. They were unproven. But because of the EUA, the emergency use authorization, this allows the use of all the unproven experimental test kits. Here's what they said. I actually read this somewhere. Quote, "There's no time to see if they work." That's an emergency.
If this video has resonated with you, discover Awakening Pro and awake like a pro. With Awakening Pro you will get access to all our information. Also you will benefit from the huge amount of funds that we will get for humanitarian and ecological projects worldwide.